Senator Murray.
Secretary Shinseki, as I said in my opening, the announcement that the President is sending one of his top advisors to assist in this nationwide review is good news. I'm confident Mr. Neighbors will help make sure that this review is comprehensive and accurate. It is critical that this review is effective because at a hearing of this committee that I called in November of 2011, I asked Dr. Mary Schoen, VA's Director of Mental Health Operations, whether facilities were gaming the system and not fully reporting wait times, and she told me she was unaware of any facilities doing that and that VHA was doing audits to make sure it wasn't happening. But there, as you know, have been an overwhelming number of allegations system-wide that wait times are being doctored, and the oversight organizations have reported on it for years. The department so far has been unable to provide me even the most basic information on how this nationwide review is going to be conducted or what it will look like, and I hope that is about to change, and I want you to explain how this review is going to be conducted.
Let me call on Dr. Petzel to give you details.
Thank you, Mr. Secretary. Senator Murray, there are going to be several phases to what we do. This week, we are auditing with the in-person teams and an anonymous survey the first tranche of facilities, all 151 medical centers and our largest clinics. Starting next week, we're going to work our way down to all of the other sites of care, gathering information, and I think the anonymous nature of the questionnaire is particularly important, information about whether or not people have felt forced to do things that were inappropriate and lacking trust and integrity in the scheduling system. The second part of this is an assessment, as a number of people have mentioned, as to whether or not we have our resources deployed appropriately, whether or not we have the appropriate amount of resources, and just as importantly, whether or not we're using those resources in the best way at each one of our sites. I think everybody needs to remember that we do 85 million outpatient visits every year. 95% of those visits are with established patients, and those are all accomplished within 14 days.
I appreciate that. I want the details of how this is going to occur so that we get good information.
So we're going to focus on the new patient and the scheduling system that we have for new patients and all the other access points besides our clinics and our medical centers that we've got available for new patients. So first is the review to see how the scheduling system is being done. Second,
the assessment.
The look at whether or not we have.
Well, I would like to get the details from that on you, and I don't want to use all my time, but it's important that we know how that's going to be used and we know that real change occurs. But I just have a minute and a half left, and I want to ask you, Secretary Shinseki, Deputy Undersecretary for Health Bill Schoenhard told me at a hearing in 2012 that gaming is so prevalent as soon as new directives are put out, they're torn apart to find out how to get around the requirements. Testimony from a VA mental health employee said the exact same thing. And at that same hearing, Linda Halliday from the IG's office told us, and I quote, "If we have seen scheduling practices that resulted in gaming the system to make performance metrics look better at the end of the day over the past 7 years, they need a culture change. To get that culture change, I think they really need to hold the facility directors accountable for how well the data is actually being captured." That was more than 2 years ago, and the standard practice at the VA seems to be to hide the truth in order to look good. That has got to change once and for all, and I want to know how you're going to get your medical directors and your network leaders to tell you, whether it's through this survey or in the future, when they have a problem and will work with you to address it, rather than pursuing these secret lists and playing games with these wait times.
Well, Senator, if there's anything that gets me angrier than just hearing allegations is to hear you tell me that we have folks that can't be truthful because they think the system doesn't allow it.
Right.
You know, trust is an important aspect of everything we do here, and has been in my previous life as well. And in order to do that, we have to be transparent, and we have to hold people accountable. And what I will say to you is we're going to get into this, and it's important for me to assure veterans to regain their trust, whatever has been compromised here, that when they come to VA, they come to a good, safe, caring system, and that they'll be cared for. And for all the employees that are listening in today, I expect our employees to provide the highest quality care, safest care we can provide, given all the comments about how tough it is in the healthcare industry, and provide access to benefits as quickly as we can. That's our mission. We only have one mission. It's taking care of these veterans, and not these veterans. I'm one of them. 100,000 of our employees at VA are veterans. We have a vested interest here to get this right.
This is absolutely critical. This review will not work if those people who are telling you the information do not tell you the truth.
I agree.
Thank you, Senator Murray. Senator Isaacs.